All right. What?
Donc je vais la pierre de médecin épidémiologiste. Qui ont renforcé leur capacité de surveillance dans le cadre d'une réglementation révisée en 2005 qui s'appelle Règlement sanitaire opérationnel. Et cette réunion, elle entre totalement dans le cadre du renforcement des capacités des médecins pour leur surveillance épidémiologique. Et là, comme on partage différents systèmes
الشرق المتوسط والشمال افريقيا. فتاتي هاي الثمره من الجهود اللي صار معنا فيها سنه كامله مع وزاره الصحه والناس ان شاء الله اليوم نبدا نطلق فعاليات المؤتمر. اثناء المؤتمر راح يكون في تناول اوراق علميه مختلفه تشمل الامراض الغير ساريه، الامراض الساريه، الطوارئ، الحوادث المشتبه على كورونا فيروس اللي ظهر في المنطقه السعوديه. احنا هنا معنا وحده من الخبراء من العالم عشان نتناقش معهم كيف الدول جوات الصدر
Welcome to the third EMPHNET Regional Conference here in Morocco. Thank you for being here and sharing in this opening ceremony. I hope you enjoyed Moroccan folklore and the entry. Now please, stand for the Moroccan national anthem.
بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إنا فتحنا لك فتحا مبينا ليغفر لك الله ما تقدم من ذنبك وما تأخر ويتم نعمته عليك ويهديك صراطا مستقيما. ويهديك الله صراطا مستقيما وينصرك الله نصرا عزيزا. هو الذي السكينة في قلوب المؤمنين ليزدادوا إيمانا مع إيمانهم. ولله جنود السماوات والأرض وكان الله عليما حكيما. ليدخل المؤمنين والمؤمنات جنات تجري من تحتها الأنهار النار خالدين فيها ويكفر عنهم سيئاتهم وكان ذلك عند الله فوزا عظيما. صدق الله العظيم.
The Moroccan Ministry of Health has been a strong advocate and supporter of this conference. Regretfully, the Minister of Health, Professor Hussein Al-Wardi, could not be with us this evening, but Mr. Shtibel Hassan, the Inspector General, will deliver a speech on his behalf. I give you Mr. Shtibel Hassan.
بسم الله الرحمن الرحيم. أتشرف بإلقاء الكلمة التي كان بالمنتظر أن يلقيها بينكم الأستاذ البروفيسور حسين الوردي، لكنه لظروف عمل فإنه يلتمس العذر لعدم تمكنه الحضور معكم، وبالتالي شرفني بأن ألقي هذه الكلمة باسمه. بسم الله الرحمن الرحيم. السيد المفتش العام لوزارة الصحة، السيد مديرية علم الأوبئة ومحاربة الأمراض، السيدة مديرة المدرسة الوطنية للصحة العمومية، السيد المدير التنفيذي لشبكة إقليم شرق المتوسط للصحة العمومية EMPHNET، السيد مدير شبكة تيفينت للصحة العمومية، السيدة رئيسة فرع FETP وممثلة مراكز محاربة الأمراض بأطلنطا، السيدات والسادة مدراء برامج FETP بإقليم شرق المتوسط للصحة العمومية، السيدات والسادة الخبراء وممثلو المنظمات والمؤسسات الدولية، السادة مندوبي وزارة الصحة، أيها السادة والسيدات. اسمحوا لي في البداية أن أعبر لكم عن سعادتي وامتناني لترأس حفل افتتاح المؤتمر الجهوي الثالث لشبكة إقليم شرق المتوسط للصحة العمومية، والذي ينظم بالمملكة المغربية تحت رعايتنا الشخصية. وأنتهز هذه الفرصة لأقدم جزيل الشكر لمنظمة EMPHNET لاختيارهم المغرب لتنظيم هذا اللقاء الهام تحت شعار المراقبة الوبائية في القرن ال21. أيتها السيدات والسادة، اعتبارا الوضع الراهن للحالة الصحية الوبائية في إقليم شرق المتوسط وما تعرفه هذه الحالة من تغيرات عبر العالم، واعتبارا للدور الهام الذي تلعبه شبكة EMPHNET في التدريب والبحث العلمي في ميدان الوبائيات والصحة العمومية بشكل شامل، فإن مؤتمركم هذا يعد لقاء هاما سيمكننا بدون أدنى شك من تدارس شتى المواضيع الصحية واستنتاج الدروس والأفكار المهمة في هذا المجال، لا سيما فيما يتعلق بالمراقبة والترصد الوبائي. ولقد لاحظت بعد الاطلاع على برنامج هذا اللقاء الدولي المتميز أنه سيتطرق لمواضيع متنوعة تهم الأمراض السارية والغير السارية وغيرها من المخاطر الصحية، وكذا الدراسة والتدريب في علم الأوبئة. إنه لا يخفى عليكم أن المنظومات الصحية عبر العالم تحتاج دوما للمعلومة الصحية بصفة عامة وللمعلومة الوبائية بصفة خاصة، لأنها تلعب دورا هاما في اتخاذ القرار، إذ تمكن من إصدار بيانات وتقارير تساعد على بلورة استراتيجيات ووضع برامج صحية فعالة. وتجدر الإشارة إلى أن وجود نظام متين ومتكامل للمراقبة الوبائية يمثل حجر الزاوية الذي يقوم عليه النظام الصحي المثالي، وهو من العناصر الأساسية لجمع البيانات واستحداث المعلومات اللازمة للعاملين في المجالين الصحي والإنمائي على جميع المستويات، حتى يتسنى لهم استخدام الموارد المحدودة على أفضل وجه. والمعروف أن توفير المعلومات الصحية ذات الجودة العالية وفي الوقت المناسب بما فيها المعلومات الوبائية تعتبر من الركائز الأساسية لتخطيط وتنفيذ وتقييم السياسات والبرامج الصحية. ولتوفير هذه المعلومة وتجميعها وتحليلها واستعمالها بشكل علمي وموضوعي أصبح من الضروري تطوير وتوفير موارد بشرية وكوادر صحية متمرنة وذات كفاءة عالية في مجال علم الأوبئة. إنه لا يخفى عليكم النقص الحاصل في الكوادر الصحية المتخصصة في علم الأوبئة، إذ تسعى البلدان المعنية رغم الصعوبات إلى معالجة هذا الموضوع بشكل جدي بمساهمة وشراكة فاعلين وطنيين ودوليين. نذكر من أهمهم مراكز محاربة الأمراض بأطلنطا CDC بأطلنطا، وشبكة إقليم شرق المتوسط للصحة العمومية EMPHNET، التي أنتهز هذه الفرصة لأشكر مسؤوليها على الأهمية التي يولونها لهذا الموضوع وعلى الدعم التقني الذي يقدمونه للمغرب ولكافة بلدان الإقليم في هذا الميدان. سيداتي وسادتي، وعيا منا بأهمية المراقبة والترصد الوبائي والوقاية الصحية، فإن وزارة الصحة بالمملكة المغربية تعطي أهمية كبرى لتطوير المعلومة الوبائية وعلى تدريب المهنيين الصحيين في مجال علم الأوبئة بما فيهم أطباء وممرضين وتقنيين. كما تحرص الوزارة على تأهيل القطاع بما يؤمن المزيد من الارتقاء بجودة الخدمات التي يسديها من وقاية وعلاج، وكذا في إطار دوره المرجعي كمتدخل أساسي فيما يخص الترصد الوبائي واليقظة الصحية. وتماشيا مع هذه التوجهات، فإن البرنامج الحكومي لفترة 2012-2016 جعل من اليقظة الصحية والمراقبة الوبائية أولوية من أولوياته، وذلك في إطار تطبيق الالتزامات الدولية للمغرب فيما يخص اللوائح الصحية الدولية التي تم اعتمادها من قبل جمعية الصحة العمومية في مايو 2005. إذا تقتضي هذه اللوائح تدعيم القدرات في مجال ترصد الأخطار الصحية العمومية ومواجهتها. وفي هذا الصدد فقد شرعت وزارة الصحة منذ سنة 2010 في وضع وتنفيذ برنامج تكوين في علم الأوبئة الميداني لفائدة مختلف مهنيي الصحة بدعم تقني ومادي من طرف مراكز محاربة الأمراض بأطلنطا، وبشراكة مع شبكة إقليم شرق المتوسط للصحة العمومية EMPHNET وشبكة FETP. وتولي وزارة الصحة عناية خاصة بهذا البرنامج، إذ توفر جميع الوسائل الضرورية من أجل تحسين جودة التكوين بشقيه الأكاديمي والميداني. وقصد تحفيز الخريجين يخول لهم هذا البرنامج الحصول على دبلوم ماستر في علم وبائيات الصحة العمومية من طرف المدرسة الوطنية للصحة العمومية. كما أننا نحرص على تعيين خريجي هذا البرنامج في مصالح الصحة العمومية والوبائية على المستوى المركزي والجهوي، حتى يتسنى لهم لعب دور ريادي في ميدان المراقبة الوبائية بشكل خاص وفي أنشطة وبرامج الصحة العمومية بشكل عام. وأود أن أغتنم هذه الفرصة لأقدم عبارات الشكر والتقدير لشريكنا CDC على الدعم الذي يقدمه للمغرب من أجل تطوير منظومة الصحة العمومية لبلادنا. سيدتي سادتي، لقد أظهرت الأحداث الصحية التي يمر بها العالم في العقود الأخيرة بوضوح أن العديد من المخاطر الصحية تشكل تهديدا عالميا يتطلب اتباع نهج منسق على الصعيد الدولي على أساس نظم وطنية فعالة ومتفاعلة لليقظة والسلامة الصحية وسياسة صحية عامة تهدف إلى تحسين صحة المواطنات والمواطنين والمساهمة في مجهودات تحقيق السلامة الصحية العالمية. وفي هذا الصدد تشتغل وزارتنا حاليا على بلورة مشروع إصلاح منظومة الصحة العامة، وذلك في نطاق تفعيل توصيات المناظرة الوطنية الثانية للصحة التي نظمت بمدينة مراكش في بداية شهر يوليو الماضي. ويرمي هذا المشروع الذي تساهم في إعداده منظمة الصحة العالمية وشركاؤنا الدوليين إلى تقوية قدراتنا الوطنية وإلى وضع قانون شامل للصحة العمومية يأخذ بعين الاعتبار أهمية المراقبة الوبائية والحاجة الملحة إلى تقويتها تماشيا مع ما ترمي إليه الاستراتيجية العالمية لتحقيق السلامة الصحية. وننتظر في هذا الإطار توصيات مؤتمركم هذا، ونؤكد لكم أننا سنأخذها بعين الاعتبار وسنعمل جادين على إدماجها في إطار اليوم الدراسي حول إصلاح منظومة المراقبة الوبائية والسلامة الصحية المزمع عقده خلال شهر فبراير لسنة 2014. وفي الختام أتوجه إليكم مرة أخرى بالترحيب في هذا اللقاء الهام، وأكرر شكري وامتناني لمنظمي هذا المؤتمر الدولي المتميز، وأتمنى لهذه التظاهرة كل النجاح والتوفيق، كما أتمنى لضيوفنا الكرام مقاما طيبا بمدينة مراكش. والسلام عليكم ورحمة الله تعالى وبركاته.
This conference could not have been possible without the tireless effort of the chairman for the organizing scientific committee. His efforts helped to pave the path here tonight and make this conference possible. Ladies and gentlemen, I introduce Professor Abdulrahman Maroufi.
Bismillahirrahmanirrahim. Their General Inspector of the Ministry of Health, their Dr. Mohammed and so Executive Director of EMPHNET, their Dr. Dionisio Jose Herrera, Director of the FETP, there are guests from CDC, the Chief of the FETP branch at United States Center for Disease Control, their FETP program directors, their experts and professors, their conference participants, distinguished guests, ladies and gentlemen. Assalamu alaikum. On behalf of the scientific and organizing committees and the Moroccan FETP program, I am pleased and honored to welcome you to the Third EMPHNET Regional Conference conducted under the theme of the Public Health Surveillance for the 21st Century. It's a great privilege and honor for us, for Morocco, to organize this conference in our country at this beautiful city of Marrakesh during the period of December from 4 to 7, 2013. This conference aims to facilitate and enhance surveillance networking on scientific research and clinical practices in the various medical fields to the next height by providing a noteworthy simulating program. This conference will bring together public health and clinical professionals and experts from the region and from different countries and international organizations of the world, and build an ambitious and unique training program focused on science-related surveillance, epidemiology and clinical research, develop new scientific approaches, hence to provide an excellent regional platform for knowledge sharing and discussion on the most recent advances in the field of public health, surveillance and disease control. I would like to inform you that 147 abstracts have been submitted to the scientific committee, 141 regular submissions and six late breakers, out of which 89 were accepted for oral presentation and 29 for poster presentation. During the conference, 4 working days, we will have 5 roundtable discussions on non-communicable disease, Middle East respiratory syndrome, coronavirus, Syrian refugees crisis, importance of effective communication between veterinary and human health surveillance, and stop polio. In addition, we also have a plenary presentation on digital disease detection. As to the conference sessions, we will have 28 sessions over the 3 days from 5 to 7 December, including non-communicable and communicable disease sessions. Each day there will be 3 concurrent sessions in addition to the 2 plenary sessions. One will be first thing each morning and the other will be from 4 to 5 p.m. each day. Poster presentations are 27 in total. I hope that your participation in the Third EMPHNET Regional Conference will provide you an opportunity also to visit this fascinating city of Marrakesh, Morocco. Thus you will be delighted by discovering the charms that lies behind this city with its historical elements, experience its culture and tradition. We sincerely look forward to your participation and contribution to the success of this conference. Wish you all a nice day in Morocco and thank you very much.
Training programs in epidemiology and public health interventions network, otherwise known as EMPHNET, is a professional network of 55 FETPs around the world. EMPHNET is a strong partner in this conference as well as the region. It is my pleasure to introduce the director of EMPHNET, Dr. Junioso Herrera.
Good evening, thank you very much. They are colleagues from the Ministry of Health of Morocco. They are distinguished people from CDC and partners. They are friends and colleagues. Greeting to everyone and welcome to Marrakesh, Morocco. First of all, I want to commend my sincerest appreciation for your presence here. I very well know the complexity of your agenda during this time of the year and also the economic difficult to involve in in one tree of this nature. Today, 16 years after creating EMPHNET in the US and more than 5 years after the incorporation of the EMPHNET, many of our dreams becoming a reality. Many of our dreams becoming a reality. We are a stronger and bigger organization with 58 programs, 7 of them in this region. We do a better job in training and supporting the surveillance activities and other areas of public health. And we have a broader number of activity in non-communicable disease and some different and important areas. It is a pleasure for me to observe and contribute with the effort of more than 3,000 field epidemiology trainings in 89 countries. Our networks, including people from all over the world, as well as people to support epidemiological intervention in many important area of the world and also in this very nice area of the Mediterranean. For EMPHNET and EMPHNET, this regional scientific conference is taking place among the field epidemiology is a real good opportunity for collaboration between the Eastern Mediterranean country, but also with collaboration with our partners, collaboration in contact with the CDC, and also interaction with some other people, for example, from the European Union and other programs. I am confident that this conference will be our most successful event this year in the region. For this reason, it is my great pleasure to welcome all of you in the name of EMPHNET, in the name of the advisory board of EMPHNET, to this regional conference. The theme of the conference, Public Health Surveillance for the 21st Century, is a perfect opportunity for the college to exchange the best practice in public health and epidemiology. At the same time, these forums offer an opportunity for students for our field epidemiology training programs to present their work and win recognition for their effort. Our meeting also strengthens the networks of common interest, which is the core element from the EMPHNET organization. I want to finish my introduction to acknowledge the work and the wonderful support to receive the organization of this conference from the organizing committee. I'd like to recognize the support of Professor Marufi and the people in the Ministry of Health. I'd like to make a special thank you to Dr. Mohamed Al-Nassour, the director of EMPHNET, and the staff of the EMPHNET, and also the support from the people in the country, the resident advisor, BIO, and the different colleagues from CDC. I am sure that EMPHNET and EMPHNET grow stronger after this conference. Our dreams and our ideas generated a new commitment, but I am sure we will demonstrate the usefulness of this alliance and also the value of the field epidemiology training program. I wish you a fruitful week. Thank you very much.
The Eastern Mediterranean Public Health Network, EMPHNET, was established in 2009 and is headquartered in Amman, Jordan. EMPHNET works to strengthen the FETPs in the Eastern Mediterranean region and build the public health infrastructure in these countries. At this time, I present to you Dr. Mohamed Al-Nassour, the Executive Director of EMPHNET.
So, allow me first to start with expressing my special thanks and appreciation to the representative of Morocco Minister of Health, the Inspector General of the Ministry, Mr. Luxon Shtibi. Then, to express my sincere thanks to our partners and guests, the U.S. Centers for Disease Control and Prevention, Dr. Linda Quick, EMPHNET Director Dr. Delicio Herrera, and the chairperson of EMPHNET Board and the head of the Conference Scientific Committee, Professor Abdurrahman Maroufi, our EMPHNET Board members, guests from WHO and other international organizations, and the warmest welcoming to all participants and guests. Good evening. I am so pleased and honored to welcome you to the third EMPHNET Scientific Regional Conference. Thank you all for your attendance and participation in this important event. Let this conference serve as illustration to the scientific work being done by FETPs and public health professionals in these regions, amid a backdrop of challenges and critical situations. Emergency response, double burden of disease, communicable and non-communicable diseases, and strengthening epidemiological surveillance will be topics for discussion over these next days, and we exchange ideas and experience. I
I am confident we will not only learn from these exchanges, but we will take the lessons and apply them as we seek to strengthen public health systems and surveillance for the 21st century and improve public health for the populations. Let us take the advantage of this excellent opportunity and work together in strengthening our regional networks and in sharing our interest and experience. We are confident that conference will help us in building our network connection and in strengthening relationships. We gather in the region under one vision, and we meet together to bridge our differences and to advance forward in an attempt to create different world. I would like to thank each of you for participating in the EMPHNET conference and for bringing your knowledge and skills to this event. Let us work together at making this a successful event. We expect you to be engaged in our sessions and to be proactive in this conference. I would like to extend my appreciation to the Morocco MOH and FETP for hosting these events, and our colleagues from CDC and TIFNET for their valuable contribution. Finally, allow me to thank EMPHNET staff for their very hard work and to convey my appreciation to all EMPHNET staff. Thank you again. Welcome to the conference. Enjoy your talk. Thank you.
Centers for disease control and prevention have long been a partner in this region, working closely with EMPHNET to support and strengthen the 8 Eastern Mediterranean region FETPs. CDC has played a key role in the success of each of these programs. We are honored to have Dr. Linda Quake, the chief of the FETP branch, join us in Morocco for this conference. Join me in welcoming Dr. Linda Quake.
Good evening. Allow me first to express my special thanks and appreciation to the representative of the Moroccan Ministry of Health, the Inspector General of the Ministry, Mr. Shabati Mushan. In addition, our thanks go to the chairperson of the EMPHNET board and head of the conference scientific committee, Professor Maroufi. Thank you. Also to EMPHNET board members and Secretariat Representative, Executive Director, Dr. Mohamed Al-Sur, and the TAFINET Director, Dr. Dionisio Ferrari, and guests from the WHO and other international organizations, and of course a very special welcome to all of the FETP program participants, resident advisors, and a very special congratulation to all of the current residents who have worked so very hard and put their work together on their investigations to present at this scientific conference. It's a true honor and a pleasure to be here tonight. I bring you very warm greetings from our CDC Director, Dr. Tom Frieden, who has a very keen interest in FETP. It is entirely appropriate this year that the focus of this conference is on surveillance, but also a bit on non-communicable diseases. Tonight I'd like to share with you some of the current thinking that CDC FETP program has, and I want to mention 2 important issues. The first is our strong interest in non-communicable diseases. Many of you today enjoyed the excellent pre-conference NCD workshop that Dr. Lamy led. One certainty in public health is that nothing stays the same. The burden of disease changes. New viruses emerge, and non-communicable diseases have taken a much larger role worldwide in morbidity and mortality. And follow on to today's excellent pre-conference meeting on NCDs, it may not surprise you to know that NCDs are responsible for nearly 40 million deaths each year, which represents 75% of all deaths worldwide. Indeed, the leading cause of death in NCDs is cardiovascular, 17 million deaths, cancers, 7 million deaths, respiratory diseases, 4 million deaths, diabetes, 1.3 million deaths. According to the World Health Organization, road traffic injuries caused an estimate of 1.24 million deaths worldwide in 2010. Half of all the road traffic accidents are among pedestrians, cyclists, motorcycles, and adults between the ages of 15 and 44 years. Those account for 59% of the deaths. 3 out of 4 road deaths are among men. I think this is clear evidence that women may be better drivers. Just a joke. 92% of these accidents occur in low to middle income countries. Southeast Asia and Africa have the highest rates. It is likely that by 2020, the largest increase in NCD deaths will be in Africa. With rapid, unplanned urbanization and globalization of unhealthy lifestyles, these really threaten us towards progress towards the Millennium Development Goals. The African region holds 12% of the world's population, but suffers from 16% of traffic mortality. In a recent study and manuscript on the burden of diseases, injuries, risk factors in the Arab world from 1990 to 2010, diseases and injuries, 291 diseases and injuries are evaluated. This is an excellent study and resource guide put together under the wise leadership of Dr. Ali Muqdad and many other public health leaders who are in this room tonight. Ischemic heart disease is the #1 cause of death in the Arab world, both in 2005 and 2010. It has replaced lower respiratory infections from 1990. Over the last 20 years, the Arab world succeeded in decreasing preterm deaths, disability for most communicable diseases in newborns, nutritional problems, maternal causes of death. Yet despite improvements, substantial burden of communicable newborn and nutritional maternal causes of death persist in the lower income countries. So there is a great deal of diversity within the region. These changes to the pattern and burden of diseases create significant challenges, while many Arab countries are now dealing with the double burden of non-communicable diseases while still dealing with problems in infectious diseases. Given the burden of NCDs and the overwhelming significance of it, what role should FETP be playing now? We're all comfortable with the original model for EIS, or FETP, which was strongly based and started and rooted in infectious diseases. However, the guiding principles remain the same and are the backbone for all public health investigations. So let's look for opportunities or models for NCD FETP capacity building by encouraging more NCD field-based investigation projects. Without evaluating NCD surveillance systems, we may continue or be in the dark. It is critical that if you investigate, you share your work, and that you publish your work, if possible. Without publishing, the knowledge that you gain will not move beyond your small circle. One of the core elements to our work in FETP should be to provide the evidence base to provide recommendations to the national NCD and then to the Ministry of Health. In order to strengthen FETP NCD capacity globally and improve the skills in NCD surveillance, prevention and control, our FETP branch Specifically, Dr. Victor Caceres led the development with the curriculum team over the last 3 years to provide or to make a series of modules, 24 modules, which can be downloaded and adapted for use for the FETP program. Through this exercise, we developed stronger relationships with our CDC colleagues and partners in NCD and found them to be extremely supportive of our FETP work. And consequently, they would like to be involved in our discussions and want to be available to us as a family of FETPs on our FETP projects. The modules include a facilitator's guide, participant guide, PowerPoint presentations, and case studies. These modules are just now available to be downloaded on the CDC website. So if you just go to www.cdc.gov, go to Global Health, and FETP, you will find these 24 modules. It's free to everyone. I want to conclude my remarks, but not without mentioning the critical part the Arab world holds in support of global polio eradication. Perhaps it's a tired subject, but not to a child that may be in a vulnerable group. To date, tremendous results have been achieved through thousands and thousands of dedicated public health workers. And there's probably not a region that has lost more vaccinators or created so many martyrs to the cause of polio. In some countries, FETP plays a singularly important role in polio eradication through investigating outbreaks, planning, and leadership to the campaigns and surveillance. Every child, whether they live in poverty or wealth, in freedom or in war, deserves to have a chance to walk into their own future. It was Harlan Cleveland, a US field epidemiologist, who said that public health and global health is fueled by unwarranted optimism. Who else but public health workers could possibly believe in global polio eradication? It's really a great honor for me to be here, and I want to thank you for the opportunity. And I look forward to this week and all the things that we will talk to together and to share together. Thank you very much.
To enjoy some of the rich culture and tradition of Morocco, we have the troupe from Marrakesh city to entertain you with traditional song and dancing, as well as two other river troupe coming from Morocco to represent the beauty and the inspiration. Welcome in Morocco. enjoying this beautiful Moroccan show, we invite you to the ceremony of the cocktail ceremony prepared in your honor. And thank you for being here and to participate in this beautiful event. And one more time, welcome in Morocco.
Mamy